Hello, and welcome back to Glycan Hub, the podcast in which we explore health, disease, and longevity through the lens of glycobiology. My name is Rina, and I am your host. Is your diet tricking your immune system? Today, we will be talking about Xeno-autoantigens. Now, you might already know that antigens are molecules or substances that our antibodies can recognize. Very often they are foreign, which allows our immune system to defend the body. But going back to the term Xeno-auto, Xeno meaning foreign and auto meaning self, so how can something be both foreign and originate in our body at the same time? You might be surprised that the answer to this paradoxical question lies in the consumption of red meat. However, this discussion on Xeno-autoantigens will take us far beyond diet, from colorectal cancer, innovative immunotherapies, all the way to animal-derived heart valves. My guest today is the principal investigator in the Department of Cell Research and Immunology at Tel Aviv University. Her research combines glycobiology, immunology, bio-nanotechnology, cancer research, and xenotransplantation. A warm welcome to Padler-Karavani. Hello and welcome to our podcast.
Welcome, thank you.
So before we get into our discussion, I want to know how you first got involved into glycobiology research and how come you decided to stay in this field?
So actually, when I graduated my PhD in Tel Aviv University, I was thinking what would be my next thing. And at the same time, there was a big publication in Science with a cover talking about glycosciences. And I was truly amazed. I didn't know anything about it. I started reading. And then I started reading more, and I found that in San Diego, there was a big hub for glycobiology. One of the key players there was Ajit Varki. And I went to interview in his lab, and I really, really liked it. So I decided that this would be my next big thing. And at the same time, I also knew that in Israel, there were not many glycobiologists, and this field would benefit from having that expertise brought back to Israel. So that was the key.
And how is the situation right now with glycobiology research in Israel, besides your lab, of course?
There are a few labs, but we still miss a national effort to leverage the glycobiology as we see in other countries, like in the United States and in England, or in other countries where you have like national resources and facilities. We don't have it here. But people that try to or stumble upon glycobiology know to contact me, and then I can deliver the message either or to refer them to other people in the field. So it's great to be one of the leaders in Israel with that.
Amazing. We have a pretty interesting discussion today. It's a very interesting topic, so I thought a good place to start is by defining some of the key terminology. So could you define what we mean by Xeno-autoantigens and Xenosialitis?
So in fact, I invented this term when I was in Ajit Varki's lab. We investigated the sialic acids called U5GC, where Ajit at the time wanted to investigate the differences between man and chimps. And one of the key things that he found is that while chimpanzees and other mammals later on discovered can synthesize this non-human sialic acids, humans miss or are genetically deficient in the gene that is synthesizing U5GC. And besides that genetic difference, there were a lot of implications. And one of the big things that even only recently we could really prove is that when we consume mammalian-derived foods, we get U5GC into our bodies, and that affects our immune system. We find U5GC, although we cannot synthesize it in our body, we can still find U5GC accumulating mostly on cancer tissues. And the only source for that would be from the diet. But our cells are self, and the U5GC is presented on self-glycans, but it's actually a non-self moiety. So the term xeno-auto means that xeno is different from a different organism. Auto means self. So it's presentation of a non-self sugar in the context of self glycans. And that's why we get auto-xeno-antigens that can be recognized by Xeno-autoantibodies that bind to these non-human sugar.
Sounds like a very confusing situation for our immune system.
Very. And in fact, there have been a lot of studies, especially in mice, but then later on in my lab, we did a lot of work in humans actually to show that the condition, this ongoing war between our immune system and our cells. So the cells take up nu5Gc as a Trojan horse and present it in the context of non-self. Our antibodies try to recognize some things that is different, pathogens or invaders. So nu5Gc in that respect is an invader. And therefore, when we develop antibodies, these antibodies try to bind and attack tissues that express nu5Gc. That's where we discovered, or Ajit actually, in Ajit Varki's lab, actually took the lead in that and defined the term Xenosialitis. That's an inflammation against this xenoglycan, and that is presented in the context of self. So our bodies try to attack this invader, nu5Gc. And it results in a puzzling situation.
I'm curious which human tissues are most affected by accumulation of nu5Gc, and how does that correlate with the diseases which are associated with red meat consumption?
It appears to accumulate in cells that divide rapidly. So, of course, the common cells would be cancer, that they lost the control over division. And we also know that in cancer, there is overexpression of the sialic acid transporter, SIAT, that then incorporates nu5Gc even faster. Although cells can also take up the sialic acid by micropinocytosis. Basically, they drink the media where they can take up the glycans or glycoproteins or glycolipids. And so cancer cells mostly, but the other cell types would be endothelial cells. Cells that divide rapidly.
Now, you said it is a pretty confusing situation as it's a Xeno-autoantigen. So is autoreactive inflammation or autoimmunity, is it commonly associated with nu5Gc?
I can say that many years ago, nu5Gc was defined as hanganische Daische moiety, based on the discovery of these investigators. That's the names of the investigators. And at the time, although they didn't know exactly what was the antigen, they thought maybe it would be only the glycolipid that contains nu5Gc. Now we know that it's much more broad. Then they discovered this HD antigen in many different types of diseases, the antigen and the antibodies, in autoimmune diseases, in many chronic inflammation diseases, and that later on it was also shown in more sophisticated tools that these antibodies really play a role in cardiovascular diseases, in other types of autoimmune diseases, some in diabetes as well, and in cancer, of course. So whenever you have the antibodies, it basically mediates chronic inflammation that supports in cancer. It could support cancer growth, but on the other side, it can also be used as a therapeutics if you use it at a good and high amount levels, high affinity antibodies. Then this could be turned into a supportive treatment rather than a devastating disease.
Could you please comment on what are some of the other theories for the red meat associated disease risk?
There are many explanations in terms of red meat and disease. Of the most common one we know that is cholesterol, that is associated with heart disease. But of course there are many others like TMAO and different compounds when you grill the meat. There are many theories, but what I can say is none of these theories was specific for red meat. But then recently we found that the level of the antibodies that we can find within humans is associated with a level of red meat. And that could explain the association between cancer risk and red meat consumption, and that would be specific for red meat or mammalian-derived foods in general. So the level of Nu5GC that is consumed could be linked to the level of antibodies. That was key to understand, where you have one explanation that would basically summarize many different types of diseases, including cancer.
I think it would be interesting if you could tell us a bit about global trends in statistically looking at the correlation between colorectal cancer in particular and red meat consumption.
Thank you. That's a very good question, because when we started to investigate that, we actually looked at databases for national red meat consumption across the world in over 120 countries, including United States, Australia, all Europe, Africa, Asia. And then at the same time, we also had access to another database that had tracked the colorectal cancer risk. And we found a direct correlation between higher consumption of red meat and higher risk of colorectal cancer. So in countries that consume high levels of red meat, like United States, Australia, South America, then you would have a higher risk of colorectal cancer. And it's the opposite in countries that consume low levels, like India or Africa, except for South Africa, where they have annual barbecues. So we know that actually South Africa, people consume a lot of red meat, but not in most other parts of Africa.
Now, looking specifically now a bit at cancer, what are tumor-associated carbohydrate antigens, and what is the benefit of characterizing them?
We know that all cells are covered with a thick layer of glycans, and these glycans are really sugar chains that, and these sugar chains or glycans can be conjugated to proteins and lipids. And in fact, evolution had never been able to invent a cell, whether it's a virus, bacteria, yeast, or a mammalian cell, that would not be covered with sugar. So this is really, really important. But what we know is that in cancer, the sugar coating is different. So the sugar coating of cancer cell is different than that of normal human cells, or at least in any other organism as well. And it's not simple, because you don't have one gene that would determine the sugar coating. Actually, it relies on a complex metabolic pathway of a collection of enzymes, each taking one sugar unit at a time to assemble these long sugar chains. And in cancer, there are specific mutations or changes to these metabolic pathways that lead eventually to a differential sugar coating on cancer cells. And that could be used for diagnostics and therapy for cancer.
Speaking of therapy, what are some of the common types of immunotherapy, and what are their limitations?
You can divide at large immunotherapy into active or passive immunotherapy. Active immunotherapy is that you teach the immune system to attack the cancer, while in passive you just give them the therapy from outside, like antibodies or different cytokines that you can give from the outside. When we look at active immunotherapy, also here you have many different things. And for example, cancer vaccines or CAR-T immunotherapy or checkpoint inhibitions, where you can actually teach the immune system to react to the disease condition. And with sugars, of course, that is a very hot topic that people are trying to now leverage the changes in the sugar coating of cancer versus normal cells to design novel immunotherapy approaches to treat cancer specifically.
Could you maybe talk a bit about your work with carbohydrate-based vaccines?
Looking at the Nu5GC, we knew that Nu5GC accumulates mostly on cancer cells, and therefore generating an active cancer vaccine that would use or even exploit the already common anti-Nu5Gc response that could be leveraging the efficacy of the immunotherapy. So to do that, we actually generated nanoghosts that are covered with multiple presentations of Nu5Gc. And then we also optimized the immunization regime and conditions in a way that once we inject the cancer vaccine, the immune system will be high, robust, and long-lasting. And that is key, because if you have low anti-Nu5Gc response, or at least even high but low affinity, then you would not only not kill cancer, actually you would promote it. So there is a risk. So with the novel design of our nanoghost vaccine, we could show that with the regime that we have developed, we can generate robust and sustained response over time that basically teaches the immune system to attack the cells that already have the Nu5Gc.
And would this be used in addition to traditional therapies, or would this be a novel, unique treatment that could be applied?
It could be on its own, and of course it can be combined with many types of either passive or other active immunotherapies, and it has room for both. And of course, looking at the diet is key to understand which people would benefit from such a vaccine. Of course, people, because we already showed, based on studies of a very large cohort of 20,000 individuals, we showed that people who consume high levels of red meat are those that would have high levels of these antibodies that are, in fact, could be associated with a cancer risk. Those people would benefit from a high antibody response, but of high affinity antibodies from the vaccine, because we know that they already have Nu5Gc in their bodies. But on the other side, people who consume low levels, they wouldn't be at risk for cancer, and for them, actually, perhaps a different types of immunotherapy would be better.
Yeah, I'm just thinking of people who are vegan or who don't consume any meat. This would not be a very effective approach, perhaps, if they developed cancer.
Not for Nu5Gc, and that's still a question that we are investigating, because in the study, we didn't have particular vegans or vegetarians, and of course that's under investigation. But we did show that people who consume low levels of red meat have low levels of antibodies. And we actually even developed a Gcemic index, that's where we took all the foods and we compared it to steak. So, and then we defined that if you take 1 or 2 steaks per week, 250 grams per steak, so half a kilo meat per week, that's on the safe side. But if you eat 4 or 5 steaks per week, then you would already have high risk of developing high levels of the antibodies that in another study we showed are associated with higher risk of colorectal cancer. So we know what are the high and lows, and we also developed a method, even without needing to questionnaire to really ask the people if they consume or not. Based on their antibody characteristics, we can say if they are high consumers or low consumers. So we have a kind of a diagnostic test to really tell if you're a high red meat eater or not. And that could support fitting the right therapy for the right people.
And could this therapy potentially be used as a preventative measure for cancer? Or could it inadvertently then support further inflammation?
The active cancer vaccine you're asking? Well, in another study, we showed that if you take antibodies that are purified from humans that were developed from the diet versus antibodies that were developed from a vaccine, in this case, a different type of vaccine, these antibodies have differential effects on cells. We don't know exactly what it means, but we definitely know that the gene network that were activated in dietary antibodies versus active cancer vaccines are completely different, and in fact a mirror image. So there is a very good chance that actually the vaccine would be beneficial rather than having high levels of antibodies from diet, we know for sure that they are different. They're not the same.
Now, going into focusing more on cardiovascular illness, which is also a very commonly associated disease with red meat intake, we're going to talk about xenotransplants. So could you define what we mean by those first?
So in xenotransplantation, we know that many people that have a diseased heart or a diseased kidney, they have to get a donor transplant. And that, of course, we know for many years that there are many different proteins, and people that get a full organ have to be immune suppressed. But even in smaller items like biological heart valves, that can also carry animal-derived tissues. So in the case of aortic valve stenosis, so for example, in heart valve disease, we know that the heart pumps the blood to the whole body, and then from the lungs also to the heart, and then from the heart to the whole body. And the unidirectional flow is mediated by heart valves. These heart valves tend to deteriorate in some individuals, more commonly over 60 or 65, and they malfunction because there is sedimentation of calcium in those tissues. And those calcium sedimentation then limit the opening and closing of the valve. And in that case, when that happens, you cannot remove the calcium anymore. The only thing you can do is to remove the valve and put inside a different valve. And then the patients have two options, either to take a mechanical valve that doesn't have any animal-derived tissue, but then they would have to take anticoagulants for life, with the risk that comes with that of bleeding. And the second option is to have a bioprosthetic heart valve that is made of animal tissues. These animal tissues are like cows or pigs or horses, and we knew when we started the study looking at that is that these animals, like chimps, have Nu5Gc, and they also have another immunogenic glycans that is associated commonly with xenotransplantation. It's alpha-gal. So these two immunogenic sugars are found in the tissues, and we found, based on a very long study that took almost 10 years, we actually tracked patients before surgery and up to 15 years after the surgery to see what happens if those individuals get the bioprosthetic heart valves that contains tissues from these animals. And what we found is that indeed, at least even immediately 1 month after the valve transplantation to remove the diseased calcified valve, these antibodies develop higher levels of anti-Nu5Gc and anti-alpha-gal antibodies. We also showed that eventually these antibodies mediate the calcification of the valve that then doesn't allow it to function. The Nu5Gc from the diet was also found in the original native valve from the patients that actually caused them to need the surgery to begin with. Does that cause the disease? We don't know. But we know that the antibodies and the sugars were there when the valve was calcified. And that caused them to require the surgery. We also know that people that receive bioprosthetic heart valve, many of them tend to deteriorate again after 10 years once they are in the body. And when we started this study, we hypothesized that the antibodies that we already have in the blood, anti-Nu5Gc and anti-gal, could possibly attack the now mechanical, the bioprosthetic heart valve. And this is exactly what we found, that the antibodies that we have, or the patients have, attack the bioprosthetic heart valve and they mediate calcification. And that process even starts very early. 2 years after the transplantation, we could see already the calcification. Although it malfunctions over 10 years, this process starts very early. Importantly, what we found is that if we generate genetically modified animals like pigs and cows that do not express these immunogenic sugars, when we try to use these tissues in an animal model, we see that even if you have very high levels of the antibodies, they would not mediate calcification. So you need both. You need the Xeno-autoantibodies and you need the Xeno-autoantigen. So you need both the sugar antigens and the antibodies to mediate calcification. If you remove we don't know about the antibodies, but if you remove the glycans, you know that it would generate probably safer valves that would not tend to get calcified in patients.
So a lot to unpack there in what you just said. One place I want to start with was that you said that patients who suffered with, who had to have their heart valves removed, you could find new 5GC even on their native heart valves. So could you maybe explain how inflammation caused by new 5GC might contribute to calcification of these heart valves?
I can say that we don't know exactly what mediates this inflammation, but we know for sure also in this native and in the calcified native valves and in the calcified bioprosthetic heart valve, we know that we found the sugar, we found the antibodies, and we found complement deposition, and we also found TNF-alpha deposition in the native calcified valves. So we know that there is a process of inflammation. Which are the cells that mediate that? That is still under investigation. And of course, once we know that, perhaps we can design then therapeutics in vivo to maybe limit that inflammation.
Now you said that these bioprosthetic heart valves do tend to fail within the 10 years of implantation. And so I'm wondering, and I'm guessing many of our listeners might be thinking that after this very long period, could you still find these original new 5GC antigens present on these heart valves which were explanted? How do you take it? Taken out? Yeah.
So actually, if the patient had the first surgery at 65, then 10 years later it malfunctioned, that means he would be 75. And at 75 to go through another surgery, that must be devastating. And what you ask is something that all the physicians or the cardiologists that actually run the surgery ask me. How do you know that you still have the new 5GC? The tissue may come from the pigs, but it's in the body for 10 years. Maybe that had been removed. And actually, to address that, we took the explanted valves in patients that had to have that valve removed, and in order to replace it again because it malfunctioned. And there we quantified the new 5GC, and we found that at least 20% of the original amount of the sugar is still there. Even after 10 years or 12 years within the body, it's still there, and the antibodies are also found within those tissues in the explanted valves.
Now, you did mention something that's very interesting, which is using animals, which usually donate these valves, and suppressing the gene for new 5GC. How could you maybe explain what the logistics would have been of incorporating this at a larger scale in a clinical practice?
So it's very complicated. Basically, many of the valves, or I would say the common valve, there are many different manufacturers, but the common practice is to use the pericardium, that's a very thin tissue that lines the heart, in order to generate the tissues of the valve. We have a frame, and then the tissues have you generate like flasks, like tissues that would then open and close to allow the unidirectional blood flow. And in order to generate one such valve, you would need around 4 or 5 animals to generate one valve. So naturally, that is very complex because you need to generate a very large herd of animals and facilities to allow that. When we did the study, we had just a few calves of bovine and just a few small pigs that we could just use that not in order to generate a complete valve, but rather to generate, to just use the tissue to do the studies. But really to have it large scale, we need some companies that would hop in and take take on the effort to manufacture such valves.
Did you find similar issues with other xenotransplants? You mentioned kidneys as well.
I personally did not do this investigation, but we did look at anti-Nu5GC response in patients that received a transplantation of other organs, but the question was different. What we asked was, what is the outcome in these patients that are immune suppressed by receiving the anti-thymocyte globulin drugs? Patients that go through transplantation have to have immune suppression. And one of the ways to do that is to use an antibody against T cells. These antibodies against T cells are produced in rabbits, most commonly. Rabbits are non-human mammals. They have Nu5GC. So these drugs actually contain Nu5GC. So when these patients received the drugs, we actually showed that these patients, although they were immune suppressed, had higher levels of anti-Nu5GC antibodies, and maybe explaining why in some individuals the transplant does not last longer, and perhaps limiting red meat consumption could also help in that respect.
I'm curious in terms of other biologics therapies where antibodies might be generated in other mammals. So what would be the implications for people who might take these medications long term, also for autoimmune conditions, for instance?
Well, I was part of a study that looked at antibody therapeutics that are, of course, we looked at Nu5GC presentation. And we did find that, actually it was in Ajit Varki's lab, it was published in Nature Medicine, that some of the common drugs that are used in the clinics do contain Nu5GC, and that depends on the production system. So if you use mouse cells like hybridomas, of course you would have Nu5GC on those drugs. And as we did with... we showed it for anti-thymocyte globulin that you have an increased antibody responses in many different contexts. We see that there is an increase in the antibody responses. And in that particular study where we looked at other drugs, common drugs that contain Nu5GC, we showed that in mice, when you have at the same time anti-Nu5GC antibodies and the Nu5GC containing drugs, that had mediated rapid clearance of the drug. And that could explain why in some individuals, those drugs don't work, or maybe you find an escape during therapy. And we don't know that for sure, but perhaps this could be also associated with a diet.
Do you think that this is very well recognized in a scientific field or the medical field, the presence of Nu5GC and the impact that might play on patients?
I know that in academia it's not very well recognized, but in the industry, yes, it's very well recognized. And I think that even the FDA requires really to look at the glycosylation pattern of antibodies as a part of the regulatory package. But there are no specific guidelines. I mean, you have to have a profile, but they don't know exactly what to ask. And I hope that with other studies, of course, we will be able to define what is good and bad, or what is a threshold that from which it would be devastating or not. Or maybe it doesn't matter for every disease, maybe only for or of every drug. Maybe there are certain drugs that are susceptible where others are not. So there is a lot of unknowns in this system.
I'm curious, you mentioned you developed an index for assessing how potentially harmful different foods are. So just to reiterate, is there a safe dose of red meat that can be eaten without the risk of Nu5GC associated diseases?
The index was not really showing the disease risk. The Gcemic index, as the name maybe implies, is just the amount of Nu5GC in different foods. We know in many mouse studies that high levels of nu5-Gc could be associated with diseases in mice. In humans, we showed that if you consume high levels of nu5-Gc, you would have high levels of antibodies. And in very limited human studies, we showed that high levels of anti-nu5-Gc antibodies are associated with diseases. So this is a triangle that is not complete all over, but there are hints that if you consume high levels of nu5-Gc, you would be at disease risk of many different types of diseases. So the index really reflects the amount of nu5-Gc in different foods. And intuitively, one can think about it as a glycemic index, where you can say how fast a food item is metabolized. So in that respect, the Gcemic index refers to the amount of nu5-Gc in different food items. And if we compare it to steak, we thought that this would be most intuitive. We gave the score of 1 to steaks and then divided everything compared to that. And what we found, for example, is that goat cheese, like Roquefort, has 3 times the amounts of nu5-Gc in steak, which means that you would need to eat 1/3 the amount of steak to reach the same amount of nu5-Gc. But I can say that, or milk, for example, had 1/10 the amount of steak, which means that you would need to drink 10 liters of milk per day in order to get to this one amount of steak. So then it kind of puts things in perspective in terms of the possible risks or possible amounts of nu5-Gc that you have in the different food items. And then a person can judge on it, for himself if that's good or bad. And I'm not saying red meat is bad. Red meat has very good advantages, like, iron and different vitamins. So it could be good. But my conclusion from this study was that, like everything in life, you should have it in balance. So too much of a good thing also is not good. And just limit the amount would be, I think, better. So 1 or 2 steaks is fine. 4, 5, 6 per week is not fine.
If I may ask, I'm curious, has doing this research impacted your personal dietary habits?
That's funny you're asking, because I really limited the amount of red meat many years ago when I started to work on nu5-Gc. And then I limited it so much that I really had to take iron infusions because it was too low. So I'm saying from personal perspective that iron and red meat could have some beneficial items in the food. So as I said, balance is good. And if you stop eating red meat like vegetarians and vegan, then you have to supplement your diet with something else, just to be on the safe side.
And I think a very good place to leave this discussion is by asking you if you think there is a potential to use anti-nu5-Gc antibodies as biomarkers of red meat associated diseases.
Well, that's very complicated. I know that people are trying to do that, but because it's so related to the diet, then it could be limited to people that perhaps eat some higher levels of red meat, and we don't know yet. But and what would be that marker? What would be that biomarker? And it's still under study. But we did come up with a ratio of the different glycans and linkages of the site, which we didn't discuss at all. It's a bit more complicated to look at the linkage of the sialic acid to the underlying glycans. So we have a way to see who are the people that have high levels of antibodies, but connecting that to the disease is still yet to be investigated.
Definitely sounds very exciting either way.
Yeah.
Thank you very much for joining me for this conversation. It was really a pleasure.
Thank you very much, Rina. It was a pleasure as well.
Now, speaking to our listeners, I hope this conversation has deepened your understanding of the interplay between diet and immune response and the transformative potential of research focusing on Xeno-autoantigens. If you would like to access more information about this conversation and Vered's previous work, follow the link in the description to the show notes for this episode. Equally, if you want to find out more about GlycanAge, head on to GlycanAge.com, where you can access a whole list of our scientific publications, blog posts, testimonials, and of course this is where you can order your GlycanAge test kit. Please don't forget to leave ratings and reviews for this episode and engage with us on social media. Thank you for listening and have a great day.